Welcome everyone to this webinar on language access in health and social services, meeting the language needs of older adults. I should let you know that this webinar is brought to you by ASIAN, which stands for Aging Services Inclusive of Asian American Networks. And we are a national technical assistance and resource center that is funded by the Administration for Community Living. Before we get started, I want to give you an overview of what is to come next and set some ground rules. So first, we will begin with panelist introductions, and then after that, we will dive into the content of the webinar. So we will begin by sharing some statistics related to language needs and limited English proficiency in the United States. We'll then move on to talk about language access barriers and their impact on older adults as they're trying to access healthcare services and social services. We'll then talk a little bit about state and federal laws related to language access and some best practice recommendations from our shared work. And we want to try to keep this conversational, so I will be presenting the main content, but I will also be interspersing the delivery of that content with questions for our two other panelists. Speaking of who, we're going to go ahead and do quick introductions. One more housekeeping item, though, is that before we schedule this webinar, we solicited questions from people as they were signing up for the webinar. And so we have a list of questions already that has come in from the audience. So once we are done with the key content of the webinar, we will take those questions first. And then after that, we will open it up to the rest of the audience. So in the meantime, if you have a question that comes up, feel free to type it in the chat. And Maya, who is our project coordinator for ASIAN and has been instrumental in pulling this webinar together, will take a note of your question and will make sure that it gets answered at the end. And with that said, if everybody else but the panelists could turn their microphones off, that would be incredibly helpful. All right, moving on to panelist introductions, beginning with me. I'm Mansha Mirza, and I am a professor in the Department of Occupational Therapy at the University of Illinois, Chicago, and I also co-lead ASIAN, our Technical Assistance and Resource Center, along with Dr. Sumitra Murthy. And like I mentioned earlier, we are supported by Maya. We couldn't do most of this without her, who is our project coordinator. We also have two guest panelists today, the first of whom is Roshita Pandey, who is a grants director at Metropolitan Asian Family Services. And we have Irene Sohn, who is executive director at Hanul Family Alliance. Thank you so much, Roshita and Irene, for being here today.
Thank you for having us.
Absolutely, absolutely. And feel free to chime in if you want to add anything, let me know and I can pause so we make sure that everybody is able to get the wealth of information that you are both bringing in today. All right, so we're going to begin by sharing some information about what limited English proficiency looks like. So based on most recently available data, more than 17.5 million older adults 65 years and older speak a language other than English at home. Commonly spoken languages include Spanish and Asian languages such as Chinese, Vietnamese, Korean, Tagalog, and Gujarati. There might be others, but these are the most common languages that have been reported in the literature. Almost 10 million older adults, which is approximately 8.71% of the total older adult population in the United States, have limited proficiency in English. And our census defines limited English proficiency as speaking English less than very well. So these numbers come from census data where people are reporting that they speak English less than very well. Majority of older adults with limited English proficiency are immigrants or they were born outside of the United States. So something important to keep in mind. So let's move on now and talk a little bit about the impact of language barriers on older adults. I think everyone who is here understands that language is critical across the spectrum of healthcare and social services. When it comes to barriers in healthcare services, there's a lot of rich information on this. Most recently, the Kaiser Family Foundation conducted a survey in the summer of 2023. They called it the Survey on Racism, Discrimination, and Health. And the interesting thing about the survey was that their sample included speakers of languages other than English. So outside of English, they also conducted the survey in Spanish, Chinese, Korean, and Vietnamese. And what they found from this survey is that nearly half of adults with limited English proficiency reported at least one language barrier in a healthcare setting in the past 3 years. Nearly a third reported difficulty with various tasks that are involved in accessing health services, such as filling out forms, communicating with office staff, understanding instructions from their healthcare providers, filling out and following prescriptions, scheduling appointments. So, all these were areas where they experienced difficulties because of language barriers. The survey data also found that adults reporting language barriers have lower levels of comfort in asking questions from their healthcare providers compared to those who are proficient in English. And when it comes to social services, it's a pretty similar story, except that we don't really have a lot of data or research. Based on what's available, we know that adults with limited proficiency in English experience difficulty with understanding eligibility criteria for different social services and public benefits programs like SNAP, for instance, or SSI. They also report difficulty with interacting with program websites and completing forms and gathering relevant documents in order to apply for access to those programs and benefits. There's also research on difficulty with understanding and responding to renewal notifications. So, for instance, people who are insured under Medicaid need to renew their Medicaid coverage. And those notifications typically come in the mail, and there's research showing that when people have limited proficiency in English, they're not able to understand what they're supposed to do in order to renew their coverage, and oftentimes end up losing coverage as a result of that language barrier. There are also individual and societal costs because of language barriers. So, at the individual level, we know that adults with limited proficiency in English are less likely to have a regular source of healthcare. They also tend to have lower rates of preventive services. So, for instance, mammogram screenings, colonoscopies, pap smears, all of which are critical for preventing future health problems or early identification of serious health problems. And because of all these factors, adults with limited proficiency in English are also at risk of negative health outcomes. They're also at risk of food and housing insecurity, and this is typically tied to difficulty with accessing social services and public programs. At the societal level, there are real financial costs associated with language barriers. So, for instance, medical malpractice claims associated with lack of adequate language supports can be huge for healthcare systems and organizations. And there's a lot of legal data available on this. Children and adults who experience language barriers are also at higher risk of serious adverse events when getting medical care. They also tend to have longer hospital stays, all of which could add to costs and expenses for healthcare entities. So at this point, I am going to turn it over to the two other panelists. And here's my question for the both of you. So both of you work at agencies that serve a lot of people who experience language barriers. So could you describe the language needs specifically of the senior clients served by your respective organizations? And specifically, what are the challenges faced by these clients, and how do these challenges affect their lives?
Yes, if I may go first. Good
Absolutely.
afternoon, everyone. Yes, Irene from Hanoi Family Alliance. We are almost 40-year-old organization that primarily targets serving Korean older adults and immigrant families in the Metro Chicago area. When we were founded 40 years ago, it was a Korean physician who really saw the needs for isolated, linguistically, culturally isolated seniors residing in senior buildings in Uptown by themselves. They had no access to resources, information, or access to any type of services that are provided through the Department on Aging or any other mainstream service providers, right? That's how the organization was founded. And today we serve each year close to 6,000 seniors and individuals through our programs. And according to census, I think about 47% nationally Korean Americans are considered to have limited English proficiency. And in Chicago area, I think the rate might be even higher. And just looking at our own data, data sets, I would say close to 90% of our clients, our older senior clients who come to our doors, they consider themselves as limited English speaking people. And many challenges that were already been described nicely by Mensha apply same to our folks. And I also take care of my own parents who are in their late 80s. So I know firsthand what it's like to live in the US without having the language skills, right? Going to the doctors is difficult. Accessing services is more challenging. Maintaining, sustaining their government benefits can be also very challenging. And because of those, limited access to different services and programs and benefits, their life become, less it really impacts their quality of their life. They feel sometimes more isolated. They're mentally, impacted. Sometimes they're also physically impacted because of all these reasons combined, right? So at 100 Family Alliance, we really try to solve this issue through providing culturally and linguistically appropriate services to our seniors, and they are mainly done through bilingual staff members that are not only proficient in language itself, but they understand the culture of our seniors. They understand, um, you know, what works for us, how our seniors speak to each other, how they understand, how instructions are given best, right? All these cultural factors are considered when we work with our senior population. And before I continue to go on, maybe I should have Rashida say a little more about her experience.
Thank you so much, Irene, and thank you, Mancha, for having us at this very important platform where we can talk about language access, especially for the immigrant population. I'm at MFS, Metropolitan Asian Family Services, and we have been serving the immigrant communities in the Chicagoland area since 1992. So almost 34 years of service, of serving our people. Almost, I can say 90% of seniors that come to us, or maybe 95, and just for context, I want to say that the population of older adults in the Chicagoland area is also increasing, so the more the people, the bigger the problem. So 95% of our older adults have language barriers, and language barriers are very severe, especially in the South Asian context, because South Asian communities are not one homogeneous group. South Asian community is a very heterogeneous group, which means there are several subgroups, sub-ethnicities. There are hundreds of languages spoken just within the South Asian diaspora. But if I have to pick and choose three main languages that mostly the people here in Chicagoland speak with great difficulty, I can say that Hindi, Gujarati, and Urdu are the three languages that are spoken. So whenever we think of language access, whenever we think of translations, it's these three languages, not one, at the bare minimum, We also have Punjabi, we have Marathi, we have Bengali, and a lot of South Indian languages. So, just to give you a context, so many languages and so many subgroups. The challenges are very severe because it impacts every aspect of their life, especially when we speak of older adults. It impacts access to basic services, of course, healthcare, right from taking doctor appointments to interacting with the doctor to following prescriptions, follow up services. Everything's in English. So they need help at every stage. Accessing basic services like nutrition, which is needed for survival, nutrition, transportation, housing, the very first step is to call to get information. And right at that step, they don't have language access. They can't progress beyond that point to even go to the website or anything else and take broader information, right? So that is a big, big challenge. Access to state and federal benefits like Medicaid, Medicare, as you rightly mentioned. First of all, the process is very complex for them to navigate. All the notices, all the benefit forms, everything is in English. So they need a lot of hand holding. Many a times they come to us with notices, which is passed beyond the time frame, and they lose their services, just out of sheer fear and anxiety. They keep the notices for 1 week, because they can't read, and then they come to us and it's passed. So then we have to re-enroll them into. So it's not just the language, it's also the fear, anxiety, lack of confidence, all of it that comes with the language problem that hinders participation in services. I would also go one step beyond. It also affects their personal and social life as well. In the communities, the civic and community engagements. We've seen several cases where seniors are not able to interact with their grandkids at home, within families where you converse, you talk, you get that confidence because many of the grandkids don't know the native language. They are English speakers, right? Or may not be very comfortable. So, we've heard stories like in a family conversation, they stop talking the moment, till the time it's a native language, it's fine. The moment it veers towards English, they stop talking and expressing. So all of that sort of builds up. So it also affects their personal lives. And in the communities, when they move around, they cannot interact with their American counterparts at all. So what happens is they're huddled in their own world, they're isolated, and isolation causes a lot of other problems, leading to physical, emotional, and mental decline. So these are some of the challenges that they are living with due to the language problem.
So much for sharing, both of you. Irene, did you want to add anything?
No, I think Rushira mentioned everything that our seniors also go through, as their seniors go through. So, I like the fact that how they are isolated in their own homes is also something that I really resonate, because of the language, limitation. They no longer feel like they are a productive member of the family anymore, and they have this disconnect and this loneliness. They're in their own shell. This causes all kinds of physical and emotional burdens on them. Yeah.
Thank you so much for sharing. Right, we're going to move along and talk about federal and state laws related to language access. We will begin with federal laws. The first of these is Title VI of the Civil Rights Act of 1964, which requires that all healthcare organizations that accept any federal funding provide equitable access to their services regardless of English proficiency. This means most healthcare organizations are mandated to provide language access because most healthcare organizations serve patients that are insured through Medicare or Medicaid, and those are federal healthcare programs. The other one that we want to share with you is Title II of the Americans with Disabilities Act. This specifically pertains to people who are deaf and or hard of hearing and require ASL or American Sign Language. So the Americans with Disabilities Act prohibits discrimination based on disability, including deafness and hearing difficulty, in all services, programs, and activities provided by state and local governments. This includes healthcare services. Also, we have the Affordable Care Act, which names language access, reducing health disparities, client-centered care, and cultural competency as key quality improvement measures. Specifically, Section 1557 of the ACA states that any hospital or clinic accepting insurance traded on the healthcare marketplace is considered to be an entity that accepts federal funding and must provide language access. And finally, we have the National Culturally and Linguistically Appropriate Services Standards, or CLAS standards, which were developed by the US Department of Health and Human Services and which describe expected practices related to language and communication between service providers and service recipients. The underlying principle for CLAS standards is to provide care and services that are understandable and responsive to the language literacy and communication needs of those who are being served. All right, next up are state laws. Some of you might be joining us from outside of the state of Illinois, but I believe most people are based in the state of Illinois and within this webinar, and so we're going to focus on language access laws in Illinois. Beginning with the Language Equity and Access Act, which is Public Act 103-0723, which was signed by Governor Pritzker in 2024. So it's fairly recent. And this act requires Illinois state agencies to provide free qualified interpreters and translation services to individuals with limited English proficiency. The act also guarantees meaningful access to state services, programs, and administrative hearings. We also have the Illinois Supreme Court Language Access Policy, which mandates that all circuit courts provide free qualified interpreters in all civil and criminal proceedings for parties, witnesses, and victims. And so individuals in the state of Illinois can request an interpreter directly from the state agency that they are interacting with. So if they're interacting with the Illinois Department on Aging, they can request an interpreter from them. If they're interacting with the Illinois Department of Public Health, they can request an interpreter from them. So they can request language access from any state agency, department, or court, and if denied, they can file a complaint with the state's language access coordinator, which in the state of Illinois is the Governor's Office for New Americans. Or they could file a complaint with the Illinois Department of Human Rights, IDHR, within 180 days of the event where they felt they were discriminated against or where their language needs were not accommodated. All right, we're going to now talk a little bit about promising practices in supporting language needs for older adults, and a lot of these stem from the work that we ourselves have done. So at our Technical Assistance and Resource Center, we work with translators to translate many of our handouts, flyers, resource booklets in multiple different languages. So these are some lessons that we've learned through that process. So first up, focus on conveying meaning over literal translation. So for instance, what we've learned is that if you're trying to translate a term like social security income or supplemental security disability insurance, instead of doing a word-for-word translation of every single word in that title, we now retain the English title. We transliterate it using the script of the target language, but we retain the English title, and instead we explain what that means, so what this public benefit covers, who is eligible. So we found that conveying meaning is more accessible than literal translation when it comes to translation of documents. The other thing we've learned is that a lot of older adults, like I mentioned earlier, in the United States who are limited proficient in English were born outside of the United States. However, they have spent many years living in this country. So these are diaspora populations, and the way they speak their native language or the language from their country of origin is very different from the way that people in that country speak that language. So we've discovered through working with translation agencies that there's a tendency to translate documents as well as spoken language, using words that would be spoken by people living in those countries of origin versus words that would be spoken by diaspora populations. So we've often been in situations where we have all our materials translated in a particular language, and when we show up at the event or at the workshop, the seniors or the older adults there will say, well, where's the handout in English? And we're like, well, we have one in your native language. And they say, yeah, that's helpful, but I need both. So something to remember, that these are diaspora populations that probably speak a mix of their language of origin, but also now speak a little bit of English and might need mixed translation to meet their language needs. The other thing we've learned is that it's important to consider intergenerational language needs of older adults and their caregivers. So caregivers are typically younger and they are more proficient in English. So we've encountered situations where we've had all our materials translated and the older adults we're working with are like, well, where's the English copy of the handout? And we're like, oh, we thought you were going to use the Hindi or the Urdu copy. And they'll say, well, but this is for my son or my daughter-in-law who supports me in my medical care, so I need a handout for them, and they only read English. So again, something to keep in mind is the intergenerational language needs of older adults. At the organizational level, we recommend conducting staff trainings to build awareness about federal and local laws and standards related to language access. A lot of times, organizations are unaware that providing language access is federally mandated. If you're at an organization that is starting to think about these issues, we recommend starting with an institutional audit, thinking about what is already in place, thinking about what the language needs are, and then creating a language access plan. It's also recommended to establish a community advisory board, so having representation from community members who understand the community's language needs, so you can identify what priority languages you want to focus on and generally obtain guidance and recommendations to making your work and your services linguistically and culturally accessible. And then, the day and age that we're living in, there is so much AI use that we thought that we would be remiss in not talking about the role of technology and how that's changing best practices in language access. So these days, we have AI translation applications, also known as machine translation. Some commonly used applications are Google Translate, Amazon Translate, ChatGPT. And I think that a lot of people are starting to use these to provide language access. So just a word of caution, there's a group of researchers that actually did a side-by-side comparison of AI-generated translated materials and a human translator. And what they found was that, of course, AI is definitely faster and definitely more cost effective. However, there is a real disadvantage when it comes to legal and medical jargon. So AI is not always accurate in translating jargon because a lot of legal and medical terminology tends to be place specific. So we might use certain terms in Illinois, right, to describe state benefits that might not be used in another state or in some other part of the world. But AI is kind of using data and information from all over. So sometimes these terminologies don't get accurately translated. AI is also not very good at capturing idiomatic expressions that might again be very unique to a particular space or place, at capturing metaphors and subtle cultural nuances. So the general best practice here is that you can use AI to get started, but always have a human translator who is qualified and bilingual to verify the accuracy of those translations. So once again, I'm going to stop here and I'm going to ask our other two panelists to share their insights. So Roshita and Irene, my next question for the two of you is, what approach or model do you use to support the language needs of your senior clients?
Okay, so I think if I may just start, Irene. So, for us, the first thing that we do is that the language access, we make it part of our core programming. It is part of our core program infrastructure. It is not an add-on. It is not like a support service. So for every phase of programming, right from outreach to intake, to assessment, to intake, to service delivery, to all the documentations, all of this is done in our South Asian language, at least Hindi and Gujarati, and if there are other languages as well, because they need help at every stage, right? So it's core part of our programming. All of the program tools are translated. There's written translation done. There's live translation given. For the all the information. So that's core part. That's one thing. Secondly, a very important thing for us is to hire from the community that we serve. So our staff is mostly from the South Asian community. Having said that, we do keep in mind that we hire bilingual staff, as it has been emphasized. Irene spoken about it. Mansha, you have spoken about it. How important it is to have cultural and bilingual staff. A lot of caregivers who come. The native languages may work for our senior clients, but the caregivers, English works better for many of them. So we keep that in mind. So we have staff that speaks both languages. And also culture is very important because language and culture go hand in hand. The cultural nuances, even if you give the best translation, but you miss out on the cultural nuance, you lose the client, or you cannot address their needs accurately. So bilingual, bicultural staff is very important. I do want to say that apart from the South Asian population, we also serve Middle Eastern and Eastern European population, also a little bit of Spanish. So we also have Spanish staff on board and people from Eastern European countries on board. Another strategy that we have for language access is running ESL classes. So you know how the saying goes, right? You give a fish, they eat it for a day, but you teach somebody to fish, they have the fish all their lives, right? So we've been running ESL English assistance classes for the past 15 years, if not more. And the average age of students in our class is 75. So it's all senior students who learn twice a week at our four centers, in Naperville, Niles, Schaumburg, and Vernon Hills. This year we've added one more center. And they are showing such great progress and making great strides in learning a language at that age. So, breaking these myths that, you can't learn a new language after a certain age, they are showing by example. Once they acquire basic language skills, they are able to pass citizenship tests. They're able to communicate with their grandkids. They're able to go shopping on their own because they can read the signs and interpret the environment around them. There's so much headway they make, and their lives, we see their quality of lives improving right in front of us. So having ESL classes, so it really gives you this two-pronged approach to tackle the problem. One is making the materials available, and the second is for them to empower them with the language skills. That works better. Yeah, these are the three main things that we do. Also, educating our population for a lot of translated material that's already out there. So you're not always reinventing the wheel. For example, if you go to Illinois Department on Aging's website, it's a hub for aging resources. They do such a good job of, incorporating so many languages, their monthly newsletter, their nutrition newsletters. Even websites, even companies like, let's say, American Diabetes Association or American Heart Foundation. These are great places where they have translated material. Research studies that are having, much of the research that you all are doing for the Asian community, you are generating such a wealth of language access resources. So we know it, but many a times we don't communicate and educate our community enough about these resources. So disseminating such information, that also helps. Finding them the right resources. And lastly, I would say advocating. We as community-based organizations, it's if we can and wherever, we must advocate to have our languages included, especially in the helpline and call center numbers. So, yeah, these are some of the approaches, some of the models that we follow at MAFS. And I'm sure, Irene, if you can add on more.
Sure. Thank you. Thank you, Rashida. I might be repeating a lot of the same things that we do here, but I think I agree with Rashida that making language access a core value of our organization is the first step that we do here at Hano as well. The core reason why the foundation was found or the organization was found is to support limited English speaking older adults. So that's embedded in our mission in all of the operational manuals. So it is critical for us to hire bilingual, bicultural staff, also educate and train all of us, all of our clients and staff and volunteers, the importance of the language access. But in order to make these services available, I think it's really critical for us to work with aging partners or funding partners who will acknowledge that we need this service and they are willing to support our programs. So, for instance, the Department of Aging, suburban area agencies on aging, we work with many different entities that are already aware of why these language access is so critical for us to deliver the same services to our right ethnic population. So sometimes it takes time even to educate our funding partners. They don't understand why they need a right translated materials for certain programs or they need a bilingual staff for certain programs, but it really takes time to educate all levels of our partners to make these programs happen. And I also want to emphasize the importance of working with each other. So working with organizations like MAFS, like other ethnic partner organizations, because we can't do it all by ourselves. And as the community gets, we're living in a global, right, world, today, we are no longer seeing one language group at a time, right? We are getting people from all parts of the country seeking services and information. And what do? We can't possibly have every staff member that speak all these different languages. So it is important to create that meaningful partnership where we could seek each other's help. And then also, I want to emphasize the importance of an organization such as CLEAS, Coalition of Limited English Speaking Elderly. They are really the core essence of that organization is to support people or organizations that serve all kinds of older adults population in the Chicago area. And when we need interpretation service, we seek to CLEAS. They are able to identify which organization has that language capacity. And CLEAS also even has their own translation service units right now to work with different managed organization companies, to work with funding partners, or to work with the government entities. So I think it's absolutely important to remember those type of entities. And going back to educating, yes, we also do teach our seniors with English and computer and how to use AI and how to also request for your language support services whenever you speak to your doctor's office or you go to hospital or wherever you go. Just learn to request that you need service in your own language. I think really starts from empowering them, and then we want them to be empowered to be able to ask that service proudly. And then I also want to emphasize working with family members is also very important. I think both of you already mentioned. Sometimes we need information in both languages because the families themselves have these language barriers. So we are ready to work with the family members who might only speak English, but we also are, play the role of bridge. We become the mediator between the family members and the first generation Korean older adults so that they are all in the same team to support each other by providing, different information and resources in their own language of their preference. And lastly, again, participating in different research, participating in census, participating in many different studies is also, I think, very critical to really quantify the needs of our limited English speaking population. Without data, we can't really, ask for the services. Without data, we can't ask for any funding. So we always, even our seniors are always encouraged to participate in different universities' research in terms of, immigrants, health status or whatever issues that has to do with the immigrant population and their language capacity. So it is something that we always, always highly encourage all of us to participate in those research studies as well. And also remember to work with universities like UIC and your department, Mansha. Yeah.
Thank
Yeah.
you so much, both of you, and thank you for the shout out for UIC. Also, Irene, thanks for bringing up CLEAS. We actually do
Yes.
have a CLEAS representative here. Um, Debbie, are you here in the meeting? And if you are, feel free to unmute and share a little bit about the work you do related to language access and what resources you have available.
Yes, I'd love to. Hi, I'm Deborah Brown, and I am with Coalition of Limited English Speaking Elderly, CLEAS. First, I would like to thank Irene and thank our host for the gracious introduction. We have been working with older adults with limited English proficiency for about 40 years, along with Hanul Family Alliance and Metropolitan Asian Family Services, two great CLEAS members. So like Irene said, we do provide language access and have our own service, and we are also at the forefront of guidance. If someone just calls in and says, if someone calls in not even speaking English and has no idea to get to where they want to go, they may call and start speaking that language over the phone and say, and they may only be able to say in English, I speak blank, and then we take it from there and we guide them to the resource in their language because we are connected to all those agencies and we know where to go. We know where to point them to. And many of the agencies that we work with, most of them have a language resource on staff. And as you were talking about earlier with the current laws regarding language access, many many legal aid clinics and health clinics do have volunteer interpreters on staff and are able to kind of assist right there. But if it's more specific than just, a legal aid office with an 800 number that anyone can call, if the need is way more specific than that, we can kind of triage it right then and there in that person's language. So, in terms of resources, we have always been eager and at the forefront of guiding limited English speaking older adults through whatever problem they have, whether it's medical or legal or whatnot. We are also very much in touch with the language access community, with other agencies. Ironically, today is National Language Barrier Awareness Day. And yesterday was
Wow.
National Interpreter Appreciation Day.
Oh,
So there's all these kinds of, you don't necessarily have to be an interpreter or a language advocate to appreciate these days. But more specifically, there are events that take place nationally. There are events in Washington to advocate for language access and resources of older adults and other ages as well. April was Illinois' Language Advocacy Month. So we just finished April. So I think most of the big events in the Chicago area are basically over. But things come up in May and June. So there are always events, sometimes also checking with local legislators and aldermen. If you're a senior out there in the community, sometimes local legislators and aldermen can guide them towards a resource or guide them to us directly. And then we can let them know where to go. But we are also connected with the local representatives of Chicago and suburban Chicago communities. And so we know where to go within the county, whether it's Cook County or, the suburban Cook County or the collar counties of Cook. Our reach stretches far. And basically we are in Illinois statewide. nonprofit. So even when we get calls for needs and assistance in Southern Illinois, we can still, not maybe if we're not directly connected to the case, we can help be an advocate for resolving the case within that area in the state through our longstanding partnerships with the Illinois Department on Aging. So I hope that wasn't too confusing, but I did want to, I did want to kind of give a wraparound idea of our breadth and depth of our services and how we're kind of able, anyone who kind of is anyone who's limited English speaking or has a family member who is limited English speaking and just kind of has that initial question and doesn't know where to go. We do welcome those questions and we're able to kind of triage it and take it from there.
Thank you so much, Deborah. That was really helpful information. So we really appreciate you sharing that with us. We also have some information from Charla Glass, who is Public Policy and Community Outreach Liaison at Envision America. Charla couldn't be here with us, but she did share some information ahead of time. Maya, do you have the information from her?
Yeah, I have some information from Charla included in a resource packet that we'll share with all of the attendees, but I can put the little blurb she shared with us in lieu of not being able to attend today.
And are you going to put that in the chat, Maya?
Yeah, I'll put that in the chat.
Great. And while you're doing that, I'll just give a broad overview of what they focus on. So Envision America has been advocating for accessible um, or translated labels at pharmacies. So that's a big challenge for a lot of people who are not able to read English, is actually reading the labels on pill bottles and medications. So that is their big advocacy push, and they are always open to new collaborators and different participating pharmacies. So if you're interested in working with them on this, recommending local pharmacies for their work, then please do connect with Charla, and we will include her information in the resource packet that we will be sending to all who registered for the webinar. All right, and with that, we can actually get on to the questions. So Maya, you have the questions. Do you want to go ahead and post them in the chat and I'll read them out and then one of the panelists will answer them?
Yeah, I'll just start from the first question that was submitted.
So the first question that was submitted is there a recommended way to gain access to language line services for non-English speakers and a potential service to translate company information to other languages for families to have access to this info and resource? So Roshita or Irene, do you have a response to that question? Or Debbie as well.
For Hanoi Family Alliance, really, the only language access service that we work with is really the CLEAS. We really heavily
Okay.
rely on the CLEAS service. But I've also seen other organizations that work with like three-way calling interpretation service phone lines, right? So I guess that could also work out in cases and times when it's appropriate. But I just want to say that if your older adults have hard of hearing, hearing somebody over the phone becomes even more challenging. So that creates really, really difficulty. That creates a huge difficulty to understand, even if it's in their own language, but to understand what's going on the other side of the phone line. So that's how I personally experienced with my dad, right? Who is on the phone call with, whatever the Social Security office persons or whoever. They always, instead of working with me as a family member, they sometimes prefer working with their own interpreter over the phone. So that has created some challenges. So just know that there could be good and bads to those telephone service lines. But I would recommend contacting to CLEAS, right, Debbie?
Great.
Yeah.
Yes, thank you, Irene. If I may speak up just for a moment, yes, we do provide certain types of services that are very helpful to older adults who are having these kinds of questions, and we are very familiar with working with their families and with working with the whole family unit to solve that problem, and with being the liaison between the company that really needs to get through something very specific and the family, which may or may not be up to date about what that company offers. So we do specialize in that. And I also saw another question in the chat. Now, I hope I'm not jumping the gun, but I did see someone ask about cheaper language resources since there are many budget constraints. And CLEAS is used to working with a lot of nonprofits in the community that do not have big budgets for limited English speaking older adults and families. So we're very friendly. If someone, we are very open to talking, and we're very friendly, and we negotiate, and we're very flexible with our rates in terms of providing language access services. So there are many agencies, and you can, contact virtually any agency in the area, but we are very familiar with these processes and with working with families and with companies to get these kinds of interactions done successfully.
Great. Thank you so much. In the interest of time, we'll just move along with the questions. So the last question about language barriers impacting social services and health equity, I hope that this was answered in the presentation, so we won't separately address that question, but I will answer the question about the process for acquiring an interpreter at UI Health. So for those of you who don't know, UI Health is a large academic health system that's affiliated with the University of Illinois, Chicago. And here's what I know. UI Health has a separate interpreter services line. The phone number for them is 312-996-3610. So the general recommendation is that when a patient is making an appointment, to also identify that they have language needs and what language they need support with while making the appointment, or if they've already made an appointment, then to call the interpreter services line and make a request for language accommodations. Typically, UI Health provides video interpretation at its hospital and all its ambulatory centers in more than 150 languages, including American Sign Language. For in-person interpreting, it's typically for specific cases involving cognitive impairment. Typically, in those cases, in-person interpreters may be made available, but you need 48 hours advance notice for that. So yeah, I hope that information was helpful. And I think we have time for one more question. And the question was, does CLEAS work with organizations and individuals who may be from another state, such as New York? And the answer is yes, CLEAS is able to work out of state. Yeah, are there other questions from the audience? If not, are there other resources that you guys want to share? Oh,
So,
absolutely.
Uh, Mansha, I just want to plug in two resources, very good resources for translation. One is Purple Communications. They, through the VRS technology, they specialize in translating for the deaf and the hard of hearing people. It's very good. You just have to schedule an appointment. They come on Zoom and the interpreters interpret for this segment of the population. And there is also a very good and very new Genie app. It's Jeenie, not G. So it's Jeenie. They provide live human interpretation in 300 languages. So you can just get their app. I'm sure there's a subscription. I think the rates are about $1 or $2 $1 or $2 per minute, something like that. But they have corporate rates as well. So but if you take that subscription, they give you an app and 24 hours, anytime you need human translation, you can just go on the app and there's a person available to translate in 300 languages. So we have some partner organizations that have been using that, and they've had a very good success rate with that. So for our
That's an excellent resource. Thank you so much, Roshita, for sharing that one. We do have a feedback poll for everyone who is joining us today. So while we tackle any remaining questions, I'm going to ask Maya to also launch the poll so people can complete it before they leave. And as she's doing that, I want to thank Roshita and I want to thank Irene and I want to thank Debbie for your precious time. All the information you shared, I'm sure is going to be very, very helpful. And a reminder that we will send out a resource packet with all this information shortly after the webinar.
Yeah,
All right.
Mancha, also, I
Yes.
see two hands raised.
Oh,
One
okay.
from Adriana Black, and then Karu also has her hand raised.
Yeah, go ahead and ask your questions. Let's start with Adriana.
Hi, Mancha. Good to see you. I wanted to just, in terms of resources, ensure that I sent the group information about a health equity center at UIC, the Odette Manan Health Equity Center. And it's a center that can be reserved completely free of charge. So if in any capacity that you would like to host in our space, we will happily host you there. There are no charges, and all of the programming that we also do in our space is also free. So we're very much leaning into ensuring that UIC is very much seen as a public university, a public institution attached to a public hospital. And we're located in a public library. So I just wanted to ensure that you all knew about that, and I'll put information into the chat.
Great. Thank you, Adriana. You cut off a little bit at the end, but we did hear the information you shared.
Oh,
And feel
sorry
free
about
to
that.
link it in the
I'll put
chat
the
as
info
well.
in the chat. Essentially, a free space if anyone needs it.
Great. Thank you. And Karu, if you have a comment or a question, we'd love to hear from you.
Yes. So I was writing a comment, but recently we are invited to participate in research, but we are not allowed to provide interpretation or translation of materials to those who are not proficient in English. Apparently, there is no national standard, although, in practice, there is a national standard for linguistically, culturally appropriate services, and it requires, or, those standards require us to provide language access. But research, there is no national standard, apparently.
Right.
And I just wonder, and Irene said, it's very important for all the adults to participate in research. And this is one of the things I was kind of really kind of upset about.
Yeah,
There
yeah.
is no national standard. And in the private sectors and private foundations, or for example, like Robert Wood Johnson foundations, those are the things advocate language access, but if there is no national standard, and to require researchers to make research accessible, it is a kind of, we would systematically exclude those who don't speak English well. So I just wonder if we can also advocate that area. And it used to be a little bit more equity is more on the focus in NIH, but because of the administrative change, I think it is getting harder and harder. And especially those, like our community, it is not so-called 10 most spoken foreign language category, then it is getting harder to make it more accessible.
That's a really, really good point, Karu. The advocacy for language access and research is important. I think, as someone who does research with different language groups, I think part of it boils down to funding, but it's not just that. A lot of times in research, we use standardized questionnaires and assessments that have been developed by other researchers. So they kind of own the copyright. And if we are to modify them in any way, which includes translating them to a different language, you need permissions and you need to validate them to make sure that they are sound from like a psychometric perspective, as in, they're valid and reliable to use in a different language. So that just creates different hurdles that researchers need to cross in order to include different language groups. It's not an insurmountable hurdle, but I just wanted to kind of share some of it from, the research side of things. But that's an excellent point, and we need to do better for sure. All right, well, thanks everyone. That's all we have time for today. There is a feedback poll that Maya has launched. Please take a minute or so to complete it before you leave the meeting. This is really helpful information for us so we can be more responsive to everyone's information needs with future webinars. Thank you so much, and I hope all of you enjoy the rest of your afternoon.
Thank you.